A South Florida Congresswoman is on her way back to Washington tonight with renewed determination to pass comprehensive health care reform. Congresswoman Debbie Wasserman Schultz of Weston spent the morning holding a roundtable with healthcare professionals, and afterwards she talked with our senior political reporter, Michael Putney, the only TV reporter at that meeting. And Michael, what's her prognosis about what kind of sweeping healthcare reform could happen?
Well, she wants a big reform. She wants a sweeping healthcare care for reform, Calvin, and one of the major reforms she wants is the public option, a government-run insurance plan. But right now, that public option looks like an uphill battle. Today's meeting of the Congresswoman's Healthcare Working Group was its fourth. More than 40 healthcare stakeholders took part: doctors, hospital administrators, small business owners, and health insurance executives.
Every single person around the table agreed, representing their own industry, agreed that healthcare reform is essential, and agreed on the basic components of reform.
Those components include basic insurance coverage for all Americans, even those with pre-existing conditions, and their coverage could not be dropped. No exorbitant out-of-pocket expenses, deductibles, or co-pays. Coverage could not be dropped for the seriously ill. No annual or lifetime caps on coverage, and guaranteed renewal of your insurance.
The thing that I took away from this meeting, and that I've taken away, quite frankly, from the last few weeks of being home, is that we actually have far more agreement than we have disagreement.
Some at this meeting do want caps on the amount doctors have to pay in medical malpractice cases. Not going to be a big part of the final bill, Wasserman Schultz says, but improved Medicare benefits will be.
From the perspective of South Florida, with our large aging population, I think this legislation is particularly important.
Public option now. We can't afford to wait.
A public option is important to organized labor and Democratic liberals, but senators like Florida's Bill Nelson don't support it. Wasserman Schultz does.
I plan to vote for a bill that includes a robust public option, and I plan to fight as hard as I can to make sure that that's in the final product.
The final product, whatever it finally contains, probably will not be finished until December.
There's so much talk about the public option, there are two senators who really can make or break that.
Yeah, two ladies from Maine, Susan Collins and Olympia Snowe, and they generally are coming down in favor of the public option, but there's no guarantee that's enough to get it through the Senate.
And then you got the big speech coming up tomorrow, joint session of Congress. What does President Obama have to do?
He has to take back control of this debate because it's clearly got out of his control in August. I think a lot hinges on what he says tomorrow night.
Michael Putney, thank you for that.